today to film a couple videos. So if you guys notice I'm in the same attire, then please ignore that. I'm also trying a new camera out that I bought. Hopefully the audio, the picture, everything works out good. Please ignore the background. I'm still working on my filming setup. I'm trying to, get back to the filming like on a roll. And please also ignore if I'm out of breath in this video. I'm going to be out of breath in the next couple videos because I'm like 8 months pregnant, ready to give birth. Anyway, so today's video is just going to be about my job as a home health RN. So if you guys are interested in that, then please be sure to stay tuned. If you're new to my channel, my name is Ngoc. I graduated with my ADN in nursing. ADN nursing back in May, so I'm just kind of a fresh nurse, So if you guys, I'm still also in school to be to bridge RN to BSN. I'm sorry, that was just a long intro, but if you guys are interested in seeing my nursing journey and also just here and there luxury good videos, then please be sure to stay tuned. I thought something was behind me, guys, and I'm trying to practice to look in the camera here. But anyway, so if you guys are interested in this video, then please be sure to stay tuned. All right, guys. So if you guys watched a couple videos ago, I did tell you guys that I have two jobs. It's a home health position and also a doctor's office. So in today's video, I'm just going to talk about the home health, and then in another video, which I'm probably going to film after this, will be the doctor's office. So with the home health, I kind of explained it in the other video, but I wasn't really thinking like graduating and being a home health nurse. I was always like, it was never something that was like first in my mind, like I'm going to do home health. And especially I always just thought it was like adults and stuff like that. But anyways, one of our friends got a job as a home health with Pediatrics, and then she kind of talked me into it. And I was like, I'll just think about it. And I looked up, and at this point I had been applying in the hospitals for like a month or two, and still didn't get anything. So I was like, why not, So, it was kind of weird, like the whole, I thought I was going in for an interview, but it was pretty much like a hire on process. So I'm guessing they really do need a lot of home health nurses. So you're kind of automatically in and you get trained. So that part was kind of weird, but, overall, I love it. I love the home health position. I'm so glad I chose it. I got several questions, so I'm going to kind of go through what I kind of remember, but I know I've seen a question, is it flexible? And for my company, and I guess my scheduler, they're really flexible with me. I kind of told them like what my schedule is or what I kind of need, what hours a day. And then, it's patients by patient, case by case. So they'll find whatever's in your area. They'll give you like, hey, this is the patient's age. This is what's going on the distance, what they need. And then, the skills that you need to do, like trach vent and G-tube, J-tube, nebulizers, basic nursing skills. So they'll kind of tell you what the case needs. And then you can accept it or not. And then you will go to an interview with like the family, and you guys meet each other. And then, if the parents like you, they'll say they'll say, yes, I want him, to the scheduler person. And then you would tell the scheduler, if you want that case or not also. And then, so I kind of give them specifics. I'm not sure if this is, you're allowed to do this with all home health facilities. So it's just something that you have to kind of get to know and ask around or ask them the questions. But I told them what I felt comfortable with as, a new nurse. I was just like, I don't know if I can like handle a trach vent patient by myself, and, pretty much home health is, you're just there by yourself. It's pretty much everything on you. You'll get trained like the first day with another nurse, kind of get used to the patient, and then pretty much you're on your own after that. So I just didn't want to take on a case that I didn't feel comfortable with, especially with like trach vents. That I'm not, and in home health, there's a lot of trach vent patients. So I was just like, no, I don't really feel comfortable with that. And I chose a certain age that I want because I am pregnant. I don't want to have to like lift, some patients you have to lift. Overall, I love it. I was able to choose kind of like my way. So, I kind of liked it like that, and the pay was great. So it's paid by each case by case. So far that's what I only have one case right now, so which is the weekends, but I will be switching. So I'll kind of let you guys know if the transition switching process is hard or not. But I do want to just do days. So all the times various nurses, I'm just a weekend nurse. So but I do know like day nurses or weekday nurses, if your patient has like hospital or doctor's office visits, then you will go with patients. Some patients go to school. So I think some nurses go to school with patients or drop them off. I know a lot of people say it's pretty much like a glorified babysitting, but hey, it's still nursing. A patient needs help, a patient needs care, and that's what you're going in the nursing field for, is nursing. The only thing I would say about home health is like starting as a new nurse is you're not going to learn a lot of RN skills, which I still really want to do, like inserting IVs or doing hospital wise things. You're not going to be able to do a lot of that stuff, but you will learn, with my facility, it's like trach vent, G-tube, J-tubes. They do like go through like central lines and all that stuff, but I haven't had a chance to do that. So I'm sure that's going to be more training if I do take on that case. But eventually, yes, I would like to be in the hospital setting just to have like that acute care hospital setting. But for right now, I really do enjoy it. The schedule works great. If I'm not able to take this case, I can just call my schedule and tell them, hey, I'm not going to be able to do this case. Maybe find me another one that works with my schedule. So if you guys, you could even just work like one day a week or whatnot. But even, once you're in their system as their employee, they're going to send you text messages, and you can like pick up shifts. It's because it's, say someone calls in or whatever, it'll be like, hey, we need coverage on this day in this area, and this is the pay rate. And you can just pick up that shift, which I kind of like too. So eventually, if I ever just need to pick up a shift or something, I can just... every single day, somebody needs help somewhere. Somebody needs coverage. So that's like the good part. You can always pick up shifts. So I really like it. There's a lot of charting, but it's EMR for my case. So that gets you really into like habit of charting. I know in the hospital there's a lot of charting, so that would really broaden or like build up your skills in charting. But I just really like to be able to take care of just like one patient. I hear that there's a lot of stress in the hospital, and for me, like I thought that this would like worked out great. How it happened with just like me doing home health in the doctor's office. It's not as much stress, and I feel like a lot of people who just start out in the hospital are so overwhelmed with what's going on and like learning this and fast paced. I felt like this was just like the best way for me to go, and I really, really do enjoy it. So I really do enjoy home health. If you're ever if you ever like have not thought about it or having trouble finding something, try home health. I was one of those people who are like, oh, I don't really want to do home health, but it's great. So I really do like it. And yeah, so I just wanted to give you guys a little snippet. I'm not sure like what other questions you guys have about it. I'll do like a follow-up video in regards to the home health and the doctor's office in a separate video. So I'll put like the home health video out first and then the doctor's office, and then I'll combine any questions in another video that you guys may have. Right now, I just wanted to kind of jump in and kind of tell you guys my experience so far as a home health RN. I do bring my own, just like a little bag with my stethoscope, and then just a journal to write things down. But pretty much at the home health, your patient stuff is there already. And then like the charting tablet or whatnot is also there. So you don't really have to bring a lot of stuff, but, just in case, always have like thermometer, gloves, alcohol swabs, blood pressure cuff, all that, just to have in case if, you never know what happens. So, I'll do a what I carry to work bag video once I get all my stuff back. I did get it all stolen from my car, like a month or so ago. So I'm still in the process of getting everything back. But yes, I just wanted to film a quick little video in regards to the home health. So I'm sorry if it's just kind of random. I just don't know what other questions you guys have. I just am just kind of talking from my head about it. So if you guys have any questions about it, just leave me them down below in the comment section, and then I'll combine everything and do an updated video. So I hope you guys enjoyed the video. Just give me any feedback. I'm going to be trying to film more videos for you guys. Sorry, I'm still trying to practice looking at the camera. Stay tuned for the next video in regards to the doctor's office, and I will see you guys next time.